Hello, and welcome to our webinar on foundational contracts supporting quality and equitable compensation. My name is Theresa Hawley, and I'm the Executive Director of the Center for Early Learning Funding Equity. We're very excited to be presenting this research and work today in conjunction with our partners on an Illinois Child Care Research Partnership. And this is work that is being done in partnership with the Illinois Department of Human Services, some folks at the University of Chicago I'll introduce, as well as Illinois Action for Children, INCRA, the Illinois Network of Child Care Resource and Referral Agencies, and us here at Selfie. And our work that we're going to be presenting today has been funded by a federal grant from OPRE. And you can see that all of our partners down here on the screen. So we're super excited to be able to present to you today some groundbreaking work that's been happening in the state of Illinois and some research that's been done to evaluate the impact of this new work. Our presenters today are myself, as I said, Theresa Hawley, and I am currently serving as the Executive Director of Selfie. Prior to this position, I was the first Assistant Deputy Governor for Education in the Governor's Office of J.B. Pritzker's Governor's Office in Illinois, and then the Director of Early Childhood Transformation. And a lot of work that we're going to be talking about today comes from and had its origins in that time when I was in the Governor's Office. So you'll have to be patient with me as I go back and forth of being we and they, because a lot of this work was done when I was, again, part of the state, but now I am at the Northern Illinois University. We also have today with us Julia Henly, who is a professor at the Crown Family School of Social Work, Policy, and Practice at the University of Chicago, and co-director of the Employment Instability, Family Wellbeing, and Social Policy Network. And she has many accolades and is a leading scholar on the impact of child care subsidy policy on family and provider well-being. David Alexander is the Director of Research at Illinois Action for Children, the nation's largest child care resource and referral agency. And he has doctoral degrees in both philosophy and labor economics, so he brings quite a passion for justice to his research on the impacts of childcare and early education policy on low-income working parents and on the providers. And they are both longtime colleagues and friends of mine, so very excited to be able to present this research with them today. To give you a little overview of what we're planning to do today and the arc of our webinar here, we're going to start out by talking about Illinois' story of how it came to do foundational funding as a strategy for supporting quality and equitable compensation in early care and education. We're going to talk through, PROSPER is the acronym that the OPRE has given to this set of grants that we're working on together. We're going to talk about that evaluation of one of the important parts of this work is called the Accelerate Contract Pilot. Then talk about the Smart Start childcare investments that the state is making that has built out of all of this work. David will share with us a little bit about what's next for Illinois and our research partnership, and then we'll have some time to be able to discuss this and answer your questions. Because we're doing this today as a webinar, we don't have a chat function available for you all. It's actually a Q&A function. So as we go along today, please put your questions into the Q&A part, and we'll be monitoring those. And then we'll, at the end of our presentation, be able to come back around and address the questions that you have. So excited for that kind of interaction with all of you. We know in our audience today, we have a bunch of people from Illinois who probably are very familiar with this work. I'm hoping from today's webinar, you'll get a little bit perhaps of an additional conceptual frame that surrounds all the work that's been happening in Illinois, as well as learn a little about the research that has been done on these important investments. For folks who are from around the country, I hope you'll learn a little bit about all the exciting work that's been happening here in Illinois. I really do think it is a model for the nation about a new way that we can invest in our early care and education sector. So I'm going to launch into just the story of Illinois' work on foundational funding for early care and education. The state has long had a goal of supporting access to high standards early care and education for young children, particularly low-income children. We have a very robust preschool for all and what we call prevention initiative, birth to 3 program, directed at making sure that kids are able to receive very high standards preschool and early learning services. But we also have a very large child care assistance program, and we want to make sure that the kids who are receiving child care assistance are also benefiting from the early education services they need. We want them to be in programs that meet high standards, that have low child to adult ratios and group sizes, high qualifications for staff, intentional curriculum implementation, and the kind of key comprehensive services and family engagement that Head Start is so well known for, that we know that low-income families need as wraparounds to their early care and education services. But what we found is, although we, like most states, had implemented a quality rating and improvement system, and in fact overhauled it in the days of the Early Learning Challenge Grant, to focus on the quality of programs that young kids were receiving, in theory, to be at that highest level, at the gold circle of quality, we call it, a program would require small class sizes and higher staff qualifications. But what in reality we were finding was that the state was having to waive the credential requirements over and over again for programs that were participating in our Accelerate QRIS because they weren't able to find enough staff that had those higher credentials. And we found that most of the programs that were rated gold and Accelerate had achieved that through an accreditation pathway, and they didn't end up actually reducing their class sizes. We in Illinois have class sizes of up to 16 for 2-year-olds. It's a real area that we knew that we wanted to support programs to be able to have those more conducive group sizes for young children. So this is the problem we had. Programs were not actually moving where we wanted them to go in terms of their structural quality. And in addition, we were a little worried that the programs that were at that gold level, that perhaps they weren't actually engaging in the kind of continuous quality improvement processes that were going to drive the process quality that we wanted kids and families to be able to experience. Why? Why were programs not moving up in our QRIS? Or another way of putting it is, why did our QRIS have no I in it? The improvement wasn't really happening in our quality rating improvement system. Well, part of that is because we kind of found that they were trapped in this vicious cycle. Programs didn't have the funding to be able to achieve, especially the structural levels of quality that they needed to have. And without that structural quality, they didn't have the time, resources, and ability to engage in that CQI kind of work to be able to do the process kind of quality that we are hoping them to get for. So it is this sort of vicious cycle. The program's not gold rated, so it doesn't get extra funding for being gold rated. Then it can't attract and retain the staff or give them more money for having the higher credentials. So the staff don't get the higher credentials, so it can't meet the gold requirement. So there it is. It's not gold rated again. And it's you're trapped there without having the funding. We really looked at this and tried to understand what can we do about this, decided that we're going to have to fund them first. We're not going to be able to wait until the program is gold rated to get more resources. We're going to have to give them more resources to get to the levels of structural and process quality that we wanted them to have. It all comes down to what is basically 2 interrelated problems with childcare wages that are so important for quality improvement efforts that you want to have in your system. First, there's low base wages across the entire field. So you have childcare staff living in poverty, using public benefits, leaving the field entirely. The low wages of the field overall are an incredible barrier to quality improvement because that constant turnover of staff means that we can throw all the coaching we want at a program. And in fact, we did for decades. And what you see is that there is a brief moment of improvement in the program, but it doesn't stick because the staff turnover and because you don't have the structural features of quality there to support and be a good ground for those quality improvement efforts to happen. Secondly, there's poor wage premiums in the staff. So staff aren't incentivized to get higher credentials because they won't make any more money having a higher credential. And so that means that programs are unable to attract and retain staff who meet those higher credentials. And again, they're back in that vicious cycle of not being able to meet these higher quality requirements that we've put on them because they can't pay the staff more. It comes down to a market failure. Compensation and quality improvement in childcare are very much constrained by the market that is the childcare market. Childcare is predominantly funded by parent tuition. It's a predominantly private marketplace, and the prices in the marketplace are tied to what parents can afford to pay. And then the prices that the state pays for the subsidies that the parents may receive if they're low income are tied to what the parents are paying in the market overall. The subsidies are usually provided on a per child basis. Programs can have, maybe this week they have 10 kids who are on subsidy. Maybe 3 months from now, they only have 4 kids who are on subsidy. It's ever changing. But for most providers, it's only a small percentage of the kids that they're serving are kids who have subsidies. So you've got this issue where the cost is higher than what the private market can pay. This is a tag or a slogan that Selfie uses often. You can't fix a market failure by just raising subsidy rates. This is something we recognized in Illinois, that we weren't going to be able to help programs get out of that vicious cycle of not having the resources to be able to be higher quality and to pay higher wages to their staff simply by looking at the rates that we were paying within the child care assistance program. We needed a new strategy to bridge that gap between market prices and the true cost of high quality services. What we wanted to do then was to come up with something that was more of a supply side investment. And this again is like, we've sort of added a vocabulary around this over time as we really thought about what is it that we're doing? What is it that we're doing differently now in Illinois? Pretty much across the country, the dominant approach to investing in childcare by the public sector has been a demand side approach, meaning you're subsidizing individual families so that they can purchase care in the private market using vouchers or certificates, whatever it is. Most of the public investment is through that demand side. What we're trying to do now is to invest also in the supply side, investments directly into programs to support them to raise wages, help support higher quality, have better group sizes, all of that. And doing that through contracts or grants that have strings attached to them, and using those strings to be able to drive the improvements in early care and education that we want to see. As we've worked on this over the last 5+ years and thinking through what the state is trying to do, it really is about trying to build a ladder of support and funding. Another analogy of this is a ratchet. We're trying to help people move up this ladder of quality by tying increasing requirements for structural quality to money that we're giving to programs, and doing that in a funding first way, giving them the money and expecting them to meet these higher standards. And then when they have been able to do that, giving them more resources so they can meet the next level of higher standards, intentionally building that ladder of support, all the while continuing to ensure affordability for families so that the cost of higher quality and the better salaries for staff doesn't fall upon the families who will not be able to afford it. We had a wonderful opportunity in 2019 when the federal government put out the application for the preschool development grant Birth to 5 to put together a pilot to test some of the ideas that we had about this funding first approach to making sure that programs had the resources to have better structural quality that supported the conditions for continuous quality improvement processes. So we created a pilot program, the Accelerate pilot, that was focused on reducing turnover with wage supplements, so raising that base wage that everyone in the program got, incentivizing the staff to get higher credentials by making sure they would get higher wages. So it's tied to the individual staff members how much the wage supplement is so that the programs are able to pay those higher wages. adding staff to the program, so programs getting into a little bit of additional staffing so that you get a little bit of breathing room and the necessary conditions for having continuous quality improvement processes in place to really focus on that process quality, the teacher-child interactions, the things that are happening in the classroom that really make the difference in kids' days. And then providing that coaching and other supports focused on the CQI. Again, we've been doing that coaching and other supports for decades in Illinois. This time we're pairing it together with the conditions that we hope are going to make that work much more successful. That is what we were focused on in 2019. In 2020, surprise, pandemic. So all of this work that you're going to hear about actually did start and get going for real during the pandemic. But what was also happening during that time was we received a whole lot of pandemic relief funding, like other states did, that allowed us to start implementing and understanding that we could implement supply side funding at scale across all programs in the childcare sector. So our childcare restoration grants, kind of first in the nation, helping programs reopen in the summer of 2020, got in a matter of 6 weeks, got funds out the door so that almost every licensed provider had access to some kind of support in their an ability to reopen after COVID had closed them. The Strengthen and Grow childcare grants were a second phase of all of that work that continued to support programs, but then started to attach strings to that with requiring a focus on compensation. And then now we have Smart Start workforce grants that are focusing directly on compensation and making sure that folks have the have resources to be able to raise wages, but also requiring them to raise wages. Later in today's webinar, I will tell you more about what's happening with the Smart Start workforce grants, and then Smart Start quality support grants, which is the state's intention and effort to continue to build on what you're going to hear more about in a couple of minutes, the Accelerate pilot, to be able to support programs to implement the quality features that we want them to have. So that's a very quick story of how we began to think of foundational funding and supply side funding as a critical part of the funding structure for early care and education, especially childcare in Illinois, so that we could ensure that children have access to the kinds of programs that they need. I'm going to turn it over now to Julie Henly, who's going to talk about the evaluation work that's been done on that Accelerate contract pilot and the things that we've been learning and how this foundational funding is supporting quality improvement in programs in Illinois. Julie?
Great. Thanks, Theresa. And Theresa, you're going to advance my slides, right?
Yeah.
You know, as Theresa said, the state embarked on this Accelerate contract pilot. I see this work. I think many people see this work that we're doing this implementation evaluation that I'm going to talk about as sort of providing some information to the state to help guide the Smart Start initiatives that are the workforce compensation grant already rolled out and the quality support grants that are coming. The objectives, some of this first slide will be a little review from Theresa, but it might be useful. So the objectives of the pilot, not of the intervention, but of the pilot, was to enhance workforce training and compensation and to improve program quality. And again, thereby really to inform the development of the future expansion of this work. This is an important point to clarify. This was the Accelerate contract pilot was only available to centers in rural areas serving at least 40% subsidized children in the state of Illinois. So that 35 should say 34 centers chose to participate in the Accelerate contract pilot. We can talk more about this later, the why rural focus. The state is planning and hoping to scale up, not necessarily just in rural areas over time, but the focus of this was for both equity reasons and also practical reasons, honestly, for this pilot. The program parameters are meant to target exactly those pieces of the puzzle that Theresa sort of outlined earlier. So these were grants that provided funding to increase the number of staff, to enhance wages, to incentivize training through a minimum salary scale that's tied to credentialing. There was also a monthly one-on-one coaching that program with the directors, and also a community of practice support group with the directors that met monthly. And I'll say more about all our findings. Third, there was a continuous quality improvement effort using a plan, do, review process with classroom teachers to try to engage in more reflective ongoing work in the classroom to improve quality. And there was ongoing technical assistance and also ongoing support to directors as they tried to implement the Accelerate Contract pilot. Importantly, the grant was conditional on participating in these pilot components. And so in the discussion, maybe we can talk a bit about sort of the trade-offs of kind of just giving money like we did with a lot of the pandemic era programs, and giving money conditional on a set of expectations. And this Accelerate Contract pilot ways. Next slide. Okay, so I'm at the University of Chicago. I don't work for the state. I'm part of this partnership, but all the work that I'm going to talk about today is really, it was an evaluation that was funded by OPRE and done in collaboration with our partners at CELFI, at the state, at Action for Children, and at INCRA, and at OPRE really, as well as partners who were running the Accelerate Contract pilot. But this is independent work, and anything I say really is work that was done by the University of Chicago and not under the state. This isn't state. This isn't work that was done by the state. Having said that, in addition to the work that I'm going to talk about today, the Governor's Office for Early Childhood Development did its own analysis of different pieces of this program, and they've released several quantitative metrics over time about how the program has operated, both GOECD as well as consultants that they contracted with. So I encourage you to look for some of that work, and maybe we can actually circulate some of that work when we circulate the slides afterwards. But just to give 3 examples of what GOECD has reported finding in the years of the pilot between February 2021 to December 2022, not using that COVID year, which was very different in many ways, they report, and this is not a pre-post, I mean, it is a pre-post, it's not a experimental evaluation, but they report that there was an increase in 107 staff in these 34 centers. There was, including directors, teachers, and teaching assistants, went from 595 in February 2021 to 702 in December 2022. That they noted the staffing pipeline with 52 teaching assistants becoming DCFS teacher qualified during this time. I didn't see a comparison group there, so I don't know what maybe the alternative would have been. And there was an increase in credentialing with 208 credentials earned during the pilot and 172 new credentials, which is made up of 172 new credentials and 36 increased credential levels. So this is not my work, our work. This is work that was reported from the GOECD. So then we come in, next slide, as part of our partnership to conduct an implementation evaluation that really had 2 parts. We took a year to really do some exploratory background research so that we could better understand what the ECP was all about. We read materials and reports. We talked to the people who were really in charge of running and implementing the program at the state level and the state's partners. We conducted many interviews with policy stakeholders, and we held biweekly meetings, as I said, with program administrators. I'm not going to talk about that background research so much, although I do think what we learned from that kind of has informed in many ways the findings I will present are from 27 qualitative interviews that we did with directors and owners of the participating centers. These were semi-structured, in-depth interviews. They lasted anywhere from 30 minutes to 90 minutes. Some of the center owners owned more than one center, so we didn't interview the same person 3 times about each center. We interviewed them once, which is why we don't have 34. 3 declined. We collected the data, we audio recorded it, we transcribed it, content coded it, and analyzed it. And this is work that I did with my project team, and especially Sarah Kwan was very involved in this work. Okay, so two broad questions guided the work. First of all, how are childcare program directors and owners participating in the pilot? How are they experiencing it? And we looked specifically at each of those components. So salary scale, one-on-one coaching, the community of practice for the directors, and the CQI. We then, from that data, try to understand what their recommendations are. So these are not necessarily our recommendations, but what the director's recommendations might be, drawing from their comments in the interviews for moving the pilot forward. Okay, so key findings. First of all, the minimum salary scale that was kind of the foundational to this was very, very highly valued by the program directors, and it was for many of them the reason they entered the pilot to begin with. We really had universally positive responses about having grant dollars to increase wages. However, the amount of the enhancement was still viewed as insufficient to really address competition from other kinds of jobs and other kinds of industries. So just as an example, the wage is still not as competitive as McDonald's. The starting wage is just barely competitive, but it's a huge improvement. In terms of the wage enhancements that were meant to incentivize credentials, many of the directors reported that they thought that they did. They said the pay and the opportunity helped staff feel valued and have things to work toward, and that motivated them to pursue credentialing. It is also true, though, that some directors felt that it was unfair, that experience and seniority weren't rewarded with the wage increases, and that only credentials were rewarded with the wage increases. And many of them said something to the effect, this is an actual quote, but there were many quotes like this: credentialing does not always correlate with performance, and we should think about experience and other ways to measure performance. The second key finding, next slide, and this has really become a major part of conclusion of our evaluation, is that administrative burden on the director's side was very high in this intervention. The corollary to that was that support from the pilot staff was essential to successful participation in the pilot. So administrative burden, what do I mean by that? It was related to really what the directors understood to be really complex and opaque reporting requirements, to IT system glitches, to errors in payroll software, to frequently changing systems and rules. There was some improvement over time, which many directors also noted, but during the time of our analysis, the system was never really fully functional, and so there were a lot of glitches throughout. So I won't read all 5 of these quotes, but you get the point. The new Gateways portal doesn't work. The Gateways website isn't working. Gateways is an amazing idea, but it doesn't work. So the sort of just challenges of using the system were great, and some of that was based on technical savvy on the side of the director, but some of it was based on system kind of failure, system glitches. So again, I said this, I think, when I started this slide, while the technical support got some mixed reviews that was provided by the program writ large, I want to just underscore that every single provider that we talked to gave like really strong praise to the program administrator and the coach, who ended up being kind of their best friends through this whole process to navigate them through, to help them navigate the system and deal with the burdens. Third point I want to make is about coaching. The monthly one-on-one coaching was really not just the majority, but by all of the directors. They were uniformly positive about the coach herself and her training and what she was able to provide. So they talked about the coach supporting professional development, helping with goal setting, accountability, and leadership training, and also advice about staff management, how to keep their organization, their offices efficiently organized, and other kind of day-to-day logistical needs that that they felt like the coach could work with. So there's a quote here. I love the coaching calls. I love them so much. They make you think to be reflective. So you're focusing not only on your own professional development, your own goals, but also the goals of your center and what you're actually doing. And this makes you accountable because you're checking off with somebody, hey, this is the goal you set. How are you doing? They also always offer ideas and are able to make you think. The coach also, I should say, helped troubleshoot some of these payroll system problems that I talked about before. Okay, the other piece of the coach's job was to do these community of practice meetings that were monthly Zoom meetings. I believe they were Zoom. They were online. They were also positively evaluated, but if we had to sort of rank them against the coaching, they were not quite as uniformly positive as the coaching, the one-on-one coaching, but they were also highly valued. They were focused on kind of emotional and informational support, and most, but not all, of the directors appreciated sharing experiences with other directors. In one or two cases, there was concern about competition, but that was not the overarching with their center colleagues. A couple of the directors would have preferred a more education-focused approach to the community of practice rather than an emotional support kind of approach. And a small number didn't find the COPs useful. So I won't read that quote there, but people enjoyed listening to other people's ideas and getting ideas from other people, as well as just being able to just kind of kvetch sometimes about what was going on. Importantly, there were, as we all know, directors are very time constrained, and the time constraints were the major barrier to full participation in the community of practice. In some of GOECD's work, I saw that they reported a statistic that 17 centers participated in at least 73% of the community of practice sessions. My guess from our qualitative work is a lot of that non-participation was constraints. One of the downsides is you have to set aside to do the COP online meeting, but when I'm here, I might have 4 different things going on at the same time, and it's just hard to set aside time specifically for the Zoom meetings. What about the continuous quality improvement activities? These received the most mixed reviews of all the different components. About half expressed positive views of the plan, do, review model. They noted the people that were positive about it noted staff engagement, a greater reflection on their practice, and more staff agency and accountability. I feel like the plan to review meetings have been extremely beneficial. It's given us a chance to really look at things in detail, sit down, talk about them. It gives us something to write down, which creates more accountability, kind of what that model is supposed to be achieving. Views, though, of the written component itself, the accountability and reporting component, some viewed it as having high administrative burden. Some saw the value, others reported it was busy work, and there was a lot of staff non-compliance. We did not interview teachers, we interviewed directors, so I think it would be really great to have teacher information here. There was some concern from the directors that the CQI or the plan to review overlapped with existing CQI that they're already doing, which created redundancies and extra work. And then once again, the time constraints and the staff turnover, which is a new issue I want to bring up, were both obstacles to CQI. So the meetings were complicated just because you just get started with a teacher, you get going, and then that teacher quits. So it's hard to find the time to do these. And also once you've sort of gotten in the routine of it, the staff turnover, which other aspects of our project suggested that turnover was reduced, but nevertheless, there's still staff turnover and that it got in the way for some of these programs and then for the CQI. Okay, so the longer report on this project has a lot more information. Those are, I would say, the highlight findings. From those findings, we glean recommendations that really come from the directors themselves. So first of all, we asked them, like, if we were going to continue this or scale it up, like, should we do that? What would that look like? There was pretty strong consensus, and I'll say more about this piece in a minute, that the pilot needed to continue, that the wage and benefit supports could be expanded so there would be less competition with other fields, and that perhaps they should reward experience and seniority, not just credentialing. I want to just say that they were very, very concerned about the grant ending, and I think we'll pick up on this in our Q&A possibly, that the participation in this grant led to them, by design, increasing the wages of their staff, and there was a concern that they just couldn't keep that up without the continued support. The second recommendation was to definitely continue the monthly coaching, and perhaps reduce the frequency of the COP sessions, the community of practice sessions, if something had to give, if there wasn't enough resources to do both. And that maybe they should consider more focused informational sessions in the community of practice if they continue it. The third recommendation is to revise the CQI, the plan to review process, to better align with the daily routines of the programs and with existing CQI systems that were already in place. And also to establish some process to bring new employees on board so there weren't these fits and starts with the CQI. The fourth recommendation was to fix gateways, to fix the way in which the wages are managed and reported, and the general kind of IT system that was important for being part of. Functionality was really a serious barrier, and there was a sense that even when it worked, we might need to simplify the payroll system and the reporting requirements. Yeah, as I say here, the administrative burden really couldn't be overstated from the perspective of the director. And then the fifth point, the quality of the staff, especially the coach and the program administrator, was very, very high from the perspective of the director, and that seemed like a critical piece of this pilot working. And IT staff support was sometimes lacking, sometimes not, depending. I mean, there was just having some human being to go to seemed very important to get support. So there seems, to be some concern about scaling this up without a really deep investment and not dumbing down the TA kind of aspect of this program. I think that's all I got. Is that right?
I think so.
Okay, so I think we're going to turn it back to Theresa now to say, so these are general findings from this implementation evaluation. I guess I do want to say two things, Theresa. One, as was very clear here, these are director perspectives on what the experience was like. This is an implementation process. It is not experimental design. We're not saying that the program worked or didn't work. And I think that's just very important. So this is really helping us understand the experiences of directors as they moved through the program.
All right. One thing that Julia wasn't really able to tell you is what the administrative burden was on the state side of this entire program, which was also incredibly high. And you hear about the coach that was there and that was totally dedicated to these 34 programs. There was a recognition that scaling up the Accelerate pilot is as successful as it is something that's going to take a long time for the state to be able to build the capacity to be able to do all of that. But really encouraging to hear what impact it has had on programs, and I think has proven, at least in my opinion, as somebody who used to be part of the state administration and decision-making structure, that this was very much a worthwhile pilot to have done, and something that we should be looking at how we sustain over time and build upon. That said, pandemic, right? When we were coming out of the pandemic, it wasn't just that we, had these resources, we were able to try all these different things out. What was happening in the early care and ed field was that the staffing for early childhood programs was in absolute crisis levels. We were hearing from programs all over the state that they were leaving classrooms unopened and not serving children because they didn't have enough staff. So we knew that even though we had to attack both of these problems, low base wages and poor wage premiums, that the focus needed to be first on starting with base level wages, because that was a problem that was so drastically impacting the field. So the Governor Pritzker put forth a Smart Start childcare initiative as part of an overall Smart Start plan that invested in many different components of early care and education. The linchpin of all this on the childcare side is the Smart Start workforce grants. I'm going to tell you a little bit in more detail what they do, but they are actually a foundational funding mechanism for increasing wages for the childcare workforce to try to improve job quality, attract the workforce, and reduce turnover. And then the intention is to build upon that over time to be able to offer Smart Start quality support grants, like growing out of the Accelerate pilot that you just heard about, to start to support improved program quality in childcare centers and homes all across the state. The workforce grants are designed to provide base funding that allow the programs to pay higher wages, but not have to raise prices for families. So the providers receive a grant that supports higher wages. We were not able as a state to extend this to all licensed programs because of the funding limitations that the state had. It really is a unbelievable and groundbreaking investment that the state has made into this program. And yet reality is that resources limited. It was focused on the programs that are actually enrolling at least a minimum percentage of children who are receiving child care assistance. So the intention is an equity focus of getting it to the programs that are serving at least some low income children. But centers and family child care across the state, it's about half of the entire child care system is eligible for the Smart Start workforce grants, and participation has been incredibly high in it. The way it works is that the grant funds have to be used on wages, and that if you take the grant, you have to agree to pay your staff at least a wage floor that is set. So for example, in center-based programs, programs will receive a grant for infant, toddler, and preschool classrooms that's somewhere around $24,000 to $27,000 per classroom per year. And in return, they agree to pay their lead teachers based on where they are in the state, somewhere between $18 and $19 an hour, teacher assistants a little bit less. Home-based programs receive a grant as well based on the number of assistants they have. If there's no assistants, it's down at $9,000. If they have multiple assistants, it could be up as high as $23,000 or more group family child care programs. And again, the home-based assistants would have a higher wage here. I think this might be a typo here. I think it's more like the teacher assistants there. So these wage floors constitute about a $3 an hour raise for teachers and assistants. Now, that's not saying that every single person got a $3 an hour raise. That's how we cost modeled and designed out the program, so that we would targeting that people's wages would go up approximately that much across the childcare industry, at least for those programs that were able to participate because they were serving subsidized kids. So this has provided sort of that first rung on the ladder of making sure that wages are being raised across the board in childcare programs to promote that program stability and staff recruitment and retention. So you're setting the groundwork to be able to improve quality, then be able to build on that with the Smart Start quality support program, and then ultimately helping programs be ready and eligible for other early childhood funding streams that support quality. In Illinois, we have a very long history of blending and braiding of funding and helping programs to use childcare funding alongside Head Start funding, alongside Preschool for All funding, and what we call Prevention Initiative, our Birth to Three educational funding stream, to support high quality, high standards early care and education. I do want to say that Illinois has embraced a both and approach to funding the childcare system, both demand and supply side investment. So I don't want you to go away from this thinking that the state has abandoned the idea of the need for high and appropriate childcare rates. From 2019 to 2024, the state has very significantly raised its subsidy reimbursement rates informed by cost modeling. And the rates in rural areas and for infants were especially raised to better meet the cost of care. But the state has now committed this $200 million in state funding to support these Smart Start workforce grants. And that is reaching nearly 14,000 early childhood educators across the state in home-based and center-based childcare. So again, a very big impact that we're seeing, at least in participation, and we want to understand what impact this is going to have on the field as we go. So I'm going to turn it over to David Alexander, who's going to talk a little bit about what our partnership is doing to understand the impact of the Smart Start program.
Okay, next slide. Let me remind you that there's room in the question and answers. So if you have questions bouncing around, please enter them into the Q&A feature at the bottom of the screen, and we'll get to them very quickly. First slide. So what we plan to do in our under the Prosper grant in evaluating the Illinois Smart Start grants will be to conduct implementation and outcome evaluations of the grants and a restructured co-payment rate, which we're not talking about today. This is largely based or inspired by the work that Julia Henly just described in evaluating the Accelerate pilot. And I think it's fair to say that that work has been inspired lots of discussions. It's been important in some of the advisory meetings, and I think it's been useful in designing the grants that have been designed so far, or in the design process. Next slide. Our evaluation is divided up into two groups of studies. They're mixed method studies. The first is the study of policy development and administration of the grants. These will be document reviews of public materials, interviews of participants and stakeholders in policy development in the grants developments, and then observations that take place during the advisory meetings and listening sessions. The second study will be directly of the implementation and outcomes. First, we have a provider panel, a survey panel with about 550 providers. There'll be three of surveys, or three waves of this. The first is out of the field now, and the data are being cleaned. It's the first one is giving us a baseline measurement of how providers feel and understand about the supports they need. Then we'll conduct provider interviews. The first one is done by the University of Chicago team, and then the Selfie and the Illinois Action for Children team will follow up on provider surveys with sets of provider interviews. Each set will have 10 or 15 provider interviews. And then finally, in the last year of the final year of the grant, we'll be conducting administrative data analysis. Mostly these will be descriptive statistics, though there might be opportunity to conduct some quasi-experimental analysis if we want to test hypotheses or we want to measure some impacts. Next slide. Sorry. So for the first set of studies, these are general research questions. Each has several sub-questions. In terms of the design and the rollout, we're interested in what considerations went into the grant design, for example, budget trade-offs, or the trade-off between accountability, increasing accountability from providers, and increasing administrative burden. Those are obviously trade-offs. And as Theresa mentioned, there's the trade-off between offering grants to a larger number of providers, or reducing, which would involve reducing the value of the grants. So there's a number of trade-offs that have been considered in designing the workforce and the quality grants. Also, we're interested in unintended consequences. So if stakeholders have concerns that something is going to backfire, or there may be something that's not being considered, we're interested in reporting that. Then we're interested in how these change over time with changing budget forecasts, or as feedback comes in from providers and advocates and other experts, how is that incorporated into the planning, the design process? And then finally, there are equity goals. And we really haven't talked about this much, but equity goals were really one of the major at the heart of a lot of this work. And so we're interested in understanding what geographic groups, for example, rural populations, demographic groups, including poor families, are included or excluded in the rules and the outreach and the take-up of the grants. Next slide. For the provider, the survey and the interviews, we're interested in getting provider experiences with the grants. And I think Julie mentioned that the administrative burden, and that played a large part in her analysis, but it also will play a large part in this analysis. Do providers see grants as burdensome? Do they see them as temporary? Or as permanent policy that they can count on for years? Do they see raising compensation as a priority? Is it their main priority? Or do they have other priorities that they're more concerned about? And we're also interested in their approach to pricing. If they're receiving support in raising compensation, how does this affect how they set their prices in the market? And also, we're interested in finding out whether they think there are unintended consequences to the grants. And then finally, we're interested in outcomes. Oh, I'm sorry.
Sorry.
Back. No, just outcomes. Do providers tell us there is less staff turnover? Is it easier to hire qualified staff? Do directors have more time to devote to quality enhancing activities? To coach, to mentor, to plan the day. And are they more likely to participate in the subsidy programs? Next. Those are just some of the sub-questions. And then finally, the administrative data study, where we'll be working with the data that the state collects from the grant applications, from provider reports, from workforce data, that that INCRA has, the child care assistance data, licensing data, and we'll be combining these data with the American Community Survey for geographic data. But we're interested in whether the prices, what happens to prices in the market? Do they rise more slowly for families because of the supply side supports? Do providers increase spaces for subsidized children? Be above the 15% threshold, or do they reduce subsidized spaces to 15%? We've asked providers about compensation and the impact on staffing, but what do the administrative data tell us about wages and staffing and retention, turnover, things like that? And then have the grants improve the quality of care? We'll be looking just at structural measures such as the teacher-child ratios. That's it. So let me introduce Carlin Baring from the University of Chicago. She's been monitoring your questions in the Q&A section. So Carlin, do you have some?
Yeah. So Julie has actually responded to a lot of these in the Q&A. So some of those have been already addressed, but a couple of things that are worth further questions and information. Some questions about how this work is kind of being expanded, or Illinois' next steps has come up a couple of times. Some of that is, state specific, right? So knowing that we're researchers and but I think you might be able to speak to some of kind of how this might be developed moving forward. So any other thoughts on next steps?
Yeah, so I'll say, like, as I said, that there's an unprecedented level of investment that the state is making in an approach like this to push for making sure that we have adequate compensation for folks in the childcare industry across the board. Illinois is at an incredibly exciting moment right now with the new Illinois Department of Early Childhood just being born. And I believe today is actually the first day of the new secretary for the department. And so a lot is going to be happening over the next couple of years as the state tries to incorporate what it's learned around the importance of these foundational funding supports for programs how it ties in with the state's longstanding commitment to quality care for children in early childhood, how it ties into the educational supports that have been provided for years through the preschool for all program, all of that. So there's much to be done here in Illinois to build on the lessons that have been learned. And that's why I think I'm so excited that the state has this research partnership and so glad to be a part of it to help continue to inform that as we move forward. Julie, some thoughts?
Yeah, I mean, I'm hesitant as the evaluator to talk about, I mean, I don't know what the next steps, how this is going to unfold by the state and what the resources will be, et cetera. But I guess I should put my hat on as researcher and say the message, and this is a little bit of reiteration of what I said, but the message from the directors is that they really hope it continues, and that I would frame it a little differently, that there's sort of an importance of stability of funding in order to continue paying their workforce, in particular the enhanced wages. It's hard to think about taking those away once you start increasing wages. And that seems not, from the perspective of directors, not possible without the enhanced, without the grants. And so I think it's an important thing for for states to think about when they enact these kinds of programs, because you can't just turn the spigot off and on, or you can, but there are probably unintended consequences of doing that. But I can't really speak to what the next steps are that the state will be doing.
A few people were also interested in how it relates to home-based providers, FCCs, that came up. So I don't know if you have any thoughts about that, since we know this pilot is focused on centers, but just maybe clarifying that a little bit and thoughts for moving forward with that.
I mean, I'll just say that I saw there were a couple questions in the chat about that. Just to be clear, this pilot was only available to centers, and so we could only evaluate centers. But I think the broader question is, because Smart Start initiatives include licensed family childcare and centers, I guess my response would be, we want to be careful in just assuming that these learnings from this implementation will necessarily apply in the same way to FCCs. And in fact, I think we know a lot. Some of my other work is on the home-based sector, and I think we know a lot about both shared and unique challenges and opportunities that home-based and centers have in responding to state initiatives, and like so I think we can start to think about what might we expect the differences could be, and how might the state wanna design future programs differently depending on sector. And I guess I would rather have David or Theresa respond to this, but my sense is the state is paying attention to that in the ad hoc with the ad hoc childcare meetings. I think there's been an effort to really think through the nuances of sector in those discussions.
Yeah, I will say, like, the Smart Start workforce grants definitely do apply for both centers and homes, and a lot of effort went into thinking through how do you best support that, how do you make that equitable across those settings, and having our advisory group help out in that design was critical to hopefully making a program that works for both centers and homes. And then for the workforce, or the quality supports grants, there's a clear recognition that it has to be designed just for homes. So you can't just import the design that you had for centers into homes. That's not the way to make it work.
I wanted to say one other thing super quickly in this last second about this, is that some of the frame of administrative burden that we use to analyze this, I think from the other literature on administrative burdens, we can almost, we can expect that programs, whether centers or homes, but I think this especially applies to homes, that have less administrative, have a thinner layer of administrative support, are going to have they're going to need a simpler system, and or greater help with the administrative component because they have fewer resources to contribute. And so I think that's the administrative burden piece is especially important in working with, in including and folding in FCCs.
Just a note too that these slides and recording will be shared out. Theresa, do you have further information about what that looks like? Many people are asking.
Yeah, stay tuned. You will get an email from us at Selfie that will have all the slides here. We have our contact information for you on here. We're always happy to interact with you and answer questions. Really appreciate everyone's participation today, and look forward to seeing you again as we have more results from the great work that we're doing in this research partnership. Thank you for joining us today.